Good morning to U.S. Senator Chris Coons. How are you today, sir?
I'm great. Good morning, Jeff. Great to be on with you.
Yeah, great to have you as well. It's been a couple months.
It's been a busy few months, Jeff.
Yeah, I'm sure. We follow everything that your office does here, and it has been, I'm going to call it a crazy couple of months, nonstop for you and other members of the Senate and the House. You've had a lot going on. Let's first briefly, if you don't mind, let's talk about the Supreme Court nomination and the attempts, of course, for the Democrats to try to stop the process, but unfortunately unsuccessful.
Jeff, we tried every procedural move and maneuver that's possible under the rules. We refused to participate in the markup. The chairman had to break the rules of the committee in order to move her out of committee into the floor. And we took a dozen different delaying and stalling votes on the floor, all the while repeating to our Republican colleagues just how unprecedented and hypocritical it was for them to jam through this confirmation 8 days before a presidential election. Never in American history has a Supreme Court nominee been confirmed by the Senate any later than July, let alone 8 days from an election. And 4 years ago, my Republican colleagues, led by Lindsey Graham, chairman of the Judiciary Committee, and Mitch McConnell, who's the majority leader of the Senate, all came to the floor over and over and said, we should not confirm a justice in an election year. We should let the voters decide. That's because President Obama was president, Justice Scalia had passed away, and President Obama nominated a centrist, widely respected judge from the D.C. Circuit. He never got a hearing. He never got a vote. Now, 4 years later, despite Lindsey Graham having said repeatedly, this will not happen, quote me back to me, it happened. And they used everything they could to force through Judge Barrett, now Justice Barrett. We did not spend the last 3 weeks negotiating a bipartisan COVID relief package. That's what we should have done. We did not pass just a simple bill that would have extended the small business loan and debt relief bill that I helped author, which we should have done. Instead, negotiations between the White House and Speaker Pelosi ultimately ground to a halt when Majority Leader McConnell said that the Republicans in the Senate wouldn't support it, and there weren't votes in his caucus for more relief for small businesses, for public health, for schools. And so in the midst of a pandemic, we have a newly confirmed justice who President Trump made clear he chose because of his confidence that she will vote to overturn the Affordable Care Act. A week after the election, on November 10th, the Supreme Court will again hear a constitutional challenge to the Affordable Care Act. And given her judicial philosophy, which is to the right of Justice Scalia, which is a big move from Justice Ginsburg, who had a quite different view, I believe she's going to reach back and join with Justice Thomas in revisiting, reconsidering, and possibly overturning a whole series of cases that impact labor rights, consumer protections, public health, privacy, reproductive rights, LGBTQ rights. You name it, I think virtually anything is on the docket in the coming years.
Well, that was always the fear, Chris, originally when, the last presidential election, the 2016 election, if President Trump were elected, the changes to the Supreme Court. Now, back then, I don't think anyone thought there would be 3 nominations, though.
Yep. No, President Trump has had an historic impact on the federal judiciary. He has confirmed hundreds of judges to the district court, circuit court, and now 3 to the Supreme Court, and that will have a generational impact on the courts. That's why I hope folks who have not yet come out to vote will decide that they should vote. If you've got questions about how, when, where, go to iwillvote.com/DE. You can get the details about your polling place. Delaware has a robust online system that allows you to track if you have requested a mail-in ballot, if you have already voted by mail. You can track exactly where it is, whether it's been received. I would encourage people at this point to go drop your ballot in person at the county election offices in all 3 counties. because frankly, I think everything's on the ballot this November, just 6 days from now.
And let's assume that we do have a President Biden in January. What do you think this might do for a future stimulus package?
Well, we're going to be in much tougher shape quickly. We are seeing record cases day after day. We're seeing hospitals swamped. We're seeing other countries begin to shut down for a second time in Europe. And I'm concerned that, as public health officials have said for 6 months, that this fall into winter will be an even tougher second round of a pandemic that was never brought under control to begin with. So we already needed a multi-trillion-dollar relief package to help businesses reopen, to help individuals and families. There's about 25 million Americans on unemployment right now. There are schools all over the country that can't safely reopen. We do have positive developments underway in terms of therapeutics and vaccines that months from now will likely be demonstrated to be safe and effective and distributed. But that's not going to happen for several months. And so, Jeff, between here and there, we've got a lot of challenges and a lot of suffering to get through. And this is why we have a federal government, is to protect the American people. Nobody in this country, asked for or caused this pandemic, but President Trump, by his bungled leadership, has failed to respond to it in a science-based, robust, coordinated way. We can't wish this away. It's here, it's reality, and we have to have a coordinated and effective response. I think Governor Carney and the public health officials in Delaware have done a strong job. We've got testing widely available. We've got science-based responses. But without more federal assistance to our state government, to local governments, to public health, to nutrition programs, Delaware Food Bank is feeding a record number of Delawareans. Without that relief package, we're going to seriously have challenges. We shouldn't wait until February when there is a new administration, if that's what happens. We should be doing it as soon as we return November 9th, right after this election.
Oh, let's hope that is the case. Well, you brought up the COVID and Delaware's great handling of it, especially compared to other states I'd mentioned on the air earlier. I went yesterday up to the Rehoboth Beach Convention Center without symptoms to get my second COVID test, and my test was 10:15 yesterday morning, and at 5:05 this morning I received a text with my results. Great turnaround time.
It is, and Jeff, that's what matters in testing, is testing that is both reliable and timely. For much of the last 6 months, as testing was gradually rolled out around the country, you could go in for a test, but you wouldn't get the results for a week.
Sure.
Well, if you test positive, that means a week where you're potentially putting lots of other people at risk. Mm-hmm. And contact tracing really wasn't set up at scale and speed across our country. I also, Jeff, went and got tested yesterday at Warner Elementary School here in Wilmington. They were open from 10 to 6. It was free, no appointment. You simply walk up, and it was no more intrusive than brushing your teeth. There's a wonderful state-run website that gives you times and locations. That Delaware has free, rapid, widely available testing is a key part of our success. Now, there's many other states where that's not the case. In Washington, D.C., the folks who work for me in my D.C. office have really struggled to get access to timely testing. And that's a key piece of why our response has not been as successful as some other developed countries. So we didn't have a nationally coordinated, rapid response that delivered reliable testing that had good turnaround times.
I want to mention, too, I've got two more topics real briefly. I want to talk about NASA, but before I do that, I understand you recently visited a couple schools in Seaford to take a look at their COVID preparations and precautions.
I did. It was a wonderful chance to visit with schools and their teachers and their staff, their paraprofessionals, their principals and leadership, and to see just what they were doing. Wonderful, dedicated, engaged teachers at schools that teach kids who want to learn, who are eager to get back to school, but with parents and school staff who understandably were very anxious about exactly how to do it. It was great to see how thoroughly engaged they were and how dedicated they were, both as teachers and professionals. A reminder, that we ask an awful lot of our teachers and school professionals, and we should be appreciative of just how hard they work to not only take care of their own families, but then to take care of and teach and educate and support our kids.
Well, you recently had a forum, a webinar, talking with an astronaut about NASA. There's been so much great space news recently, which is, amazing. We're joking here at the Daybreak Show that 2022, we want to have a show from the moon. Space travel is just incredible these days, and you're on the Appropriations Committee, which allocates money to NASA. If you could just briefly tell us a little bit about your experiences earlier this week on your webinar that you had.
Well, we had a great opportunity to have an astronaut, Dr. Jeanette Epps, who actually has a sister in Dover, in the Smyrna-Dover area, forgive me. And is an incredible, impressive, talented astronaut, someone who's had an interesting career, an engineer. She worked at Ford Motor Company. Then she worked for the CIA as a technical operations officer. Then she joined the astronaut program, the space program. And on a webinar, along with the NASA administrator, Dr. Epps, we had about 250 students on this call. She walked through the training that she's going through in order to be able to join a mission. She'll be going to the International Space Station on one of the very first crewed missions in the decade since the space shuttle stopped traveling on behalf of the United States. Every American astronaut who's gone to the space station in the last decade had to hitch a ride on a Russian rocket. And finally, after a lot of investment and development, there are 2 U.S. commercial space companies that are providing launch capacity, so that American astronauts can return to the space station and then, through the Artemis program, return to the moon. One of the goals of NASA's Artemis program is to return Americans to the moon 2023, 2024, and in particular to have a woman be part of that mission. We've never had an American woman land on the moon, and I'm optimistic that Dr. Epps will be among them. She is an engaging and talented and disciplined astronaut and described 2 different things I'll mention briefly. She spent, I think it was 8 days on the sea floor off of Florida in a subsurface training module that NASA has. And she spent 5 days very deep in a cave system in Slovenia in Eastern Europe. And in both cases, the point was to teach a whole team of astronauts how to live together under very demanding environmental circumstances where you can't leave. You can't just suddenly decide, okay, that's it, I want to go to the surface. And so much like living on the space station, or much like living together in a crew cabin on a long mission, whether to the moon or to Mars, it forces you to learn how to be flexible, how to be precise and professional, how to live together, and how to innovate to address challenges that come up. I thought it was a very inspiring talk. We partnered with FAME Delaware and the Delaware Space Grant Consortium. We had students from the University of Delaware and Delaware State University, and we had students from the high school and middle school level from schools throughout the state. It was a great experience. That's
great. Well, it's always a pleasure chatting with you. Thank you for spending part of your Thursday with us. And we look forward to talking to you again in the very near future, and best to you next week as well.
Thanks, Jeff. Great being on with you.
Yeah,
Take care.
You too.